Hi, I'm Kelsey Higdon with The Advocate, and I'm here today at the Baton Rouge Clinic with primary care Dr. John Marston, and we're going to be talking all things hypertension. So tell me, what is hypertension and why is it sometimes labeled the silent killer?
It's a great question, Kelsey. So hypertension is high blood pressure. So the force of the blood moving through your arteries is higher than it should be, and that in turn causes lots of problems down the line in different organs. It's often called the silent killer because for the most part, I would say 99% of the time, there are no symptoms. You can go about your day, wake up, go to work, play with your kids, you have no idea that your blood pressure is high. Occasionally people have symptoms with it, but by and large they don't.
So you say sometimes there are symptoms. What might those be?
So occasionally patients will come in talking about headaches that they're experiencing that are new for them, things like nosebleeds, and then occasionally more concerning things like chest pain, shortness of breath. Those can all be signs of an elevated blood pressure. But again, most people are going to have no symptoms. We really pick it up on routine visits. We pick up their blood pressures high and go from there.
How common is hypertension?
In the state of Louisiana, back in 2022, this is the last data that we could look at, about 40% of adults in Louisiana had hypertension, which is about 8% higher than the national average of 32%. And it was about a 20% jump from the previous 10 years or so. So it's just going up.
Wow, okay, so what are some different causes of hypertension and what different lifestyle changes can someone make to either prevent it or lessen the symptoms or things like that?
Sure, absolutely. While there are some patients with an identifiable cause for their hypertension, sometimes there are hormone imbalances, there can be tight arteries in the kidneys that can cause problems and lead to hypertension. The vast majority of patients have no identifiable cause for their hypertension. We call most people's hypertension primary or essential hypertension because we can't find a specific cause for it, they just have it. And it's a combination of a lot of different things. Genetics plays a big role in it, lifestyle changes, lifestyle issues, environment, things like that. Risk factors certainly is going to be dietary things like a high salt diet, no exercise, sedentary lifestyle, obesity, things like that. So those are all things we look at and trying to modify when we're treating somebody for hypertension.
How important is it for someone to come and get checked either preventatively or they already know that they have high blood pressure and just need to come and get checked out, make sure everything's good?
So, the American Heart Association recommends that all adults be screened for hypertension. If most people are coming in to see their primary care doctor once a year, you're going to get your blood pressure checked as part of that. A lot of people have blood pressure machines at home and they'll check themselves a few times a year as well. That's fine to do too. For somebody who has hypertension, all doctors are different, but I would say most patients are probably getting seen monthly to every few months while we're getting their medications adjusted and getting their doses correct, getting their blood pressure under control, making sure they're not having side effects, they're concerned about anything. Occasionally with certain blood pressure medications, we'll have to monitor certain lab values just to make sure those are doing okay. But once you're stabilized, every 6 months to a year is just fine for most people.
And what would your best advice be for someone who hasn't gotten checked in a while or maybe never has? What would your best advice be for them to come and see you or someone else at Baton Rouge Clinic?
Absolutely. So what I can tell you is if you haven't been in to see your primary care doctor in a little while, just call and make an appointment. We've got people here who can see you same day, next day for the most part. We've got quite a few primary care doctors here. They're all very well versed in treating hypertension. This is by far the most common thing that I see on a day-to-day basis. I see quite a few patients every day and probably 2/3 of them have hypertension as part of their medical conditions that I'm working on. So we can all deal with it here. We can get people in quickly. If you have a blood pressure cuff at home and are just interested, I'd recommend that you just check it maybe once a day for a couple weeks around the same time of day. Take it at a time when you're resting and quiet, not when you're running around the house with the kids or something like that, or a real stressful time. But just jot it down. You can always call or message your doctor, go in and see him, bring that in and go over things. The best blood pressure numbers to make decisions on about hypertension management is going to be ones that you get at home. Because you come into the doctor's office, you're kind of on the spot, you're concerned about it, it's going to be a little higher most of the time. So what I tell my patients for the most part is we really want to try to make decisions based on the measurements you're taking at home. So if you have a blood pressure cuff at home, you can go ahead and start that and bring those into your doctor when you see him.
Yeah. And Lastly, are there any new advancements in treatment that you're particularly excited about or want to tell us about?
Sure, there are always new things coming out for hypertension, new drugs to treat resistant hypertension that work in different ways, different procedures that we can use for people with particularly difficult to control hypertension. Some of the most exciting things, honestly, are advances in remote monitoring. So with all the new technology we have, like Apple Watches and all kinds of wrist things and rings and stuff that monitor all your parameters, right? We can hopefully link those up with your charts where we can automatically have readings uploaded to your chart. Your doctor can look at those and make decisions without you even having to come into the office. But honestly, I tell my patients all the time, if we can just do the basic stuff well, probably 80% of people with hypertension are going to be under good control, are going to do great. If we can just get you in the office, find the right medications for you, get you taking them, and just have you follow up, you're going to do just fine.
Well, thank you so much for your insights today. If you're overdue for a blood pressure check, just give Baton Rouge Clinic a call, and remember, support local.